Hey JamRock Islanders, thank you for joining me today. I'm your girl Nisa here, ready to tell you what's happening in the field of nursing. Thank you for your support and your comments and your questions. Feel free to leave your questions and your comments below. Whatever question you ask, I'll see how best I can and I'll get back to you. Thank you that you have joined me today. And so we are in for a treat today, because today we will be talking about the differences in nursing from Jamaica and the differences in nursing from the USA. And hold on to your seats, because we're gonna go through some things, y'all. We're gonna go through some things, and I hope that you will get something to help you on your journey of nursing, and you won't be scared. Don't be scared. Don't be scared. You will get through this, okay? Just remember to like, share, and subscribe to this channel, and tell your friends what's happening over this side, because we're here to teach each other, and I'm here to get information for you from whichever angle that you ask. I'm your girl. I'm your go-to girl, okay? At the end of this video, we will have our 360 buzz. So stay tuned and we will get into this. Welcome back, people. Today I will be telling you the differences that happen with the nursing system in Jamaica and the nursing system in the US, what to expect. So we'll go right ahead into it, right? All right, so the first thing, when I came to the US, I had to clock in. You have your badge, or they give you a code, and you have to clock in and out. And if you don't clock in and clock out, you don't get no pay, or you have to go to your supervisor. But the thing is, you need to clock in and you clock out. This is like the hotel system in Jamaica. Everybody, you have to clock in and you have to clock out, else you don't get any pay, right? In Jamaica, we have a book. Well, at my hospital, we had a book that we had to sign in and sign out. And I'm gonna be honest with y'all, majority of my years at my hospital, I don't remember signing in or signing out, but I get paid because my supervisors knew that I was there. That's not gonna work with you over here. You need to clock in and clock out with your badge, and make sure that you take your lunch. That brings me to the other point. Our lunch in Jamaica is 1 hour. When you get over here, it's 30 minutes, and that was a shock for me, people. 30 minutes. I was not used to that. I'm used to my 1 hour, and on night shifts, I think we get 2-hour breaks on night shifts. Any shift that you work, it is 30 minutes. So whatever you need to eat, whatever big lunch you brought to work, whatever little that you have, you need to eat it in 30 minutes and get back to work, okay? Because in Jamaica, people might not watch you, but over here, people watch the time. You're taking too long on your break. They might not say it to you, but they're gonna say it to your supervisor. So 30 minutes, people, 30 minutes. The other thing is, for dressing, we know that when we were at nursing school, we were taught sterile dressing. Miss Ferguson and Miss Wint and Miss Harvey, Mrs., all of them. Sterile dressing, people. Make sure that your gloves and everything is fine, and if your hand touches one glove, you need to change the glove. Well, over here, when I came, I realized that most of the dressing are non-sterile dressing, so you can use a mere normal glove. You hardly find dressings that you have to do sterile dressings, and when you are doing sterile dressings, they look at you like, what are you doing? You don't have to use that. Only certain things you do sterile dressing. I can remember like inserting a Foley catheter in a male or female, you use your sterile gloves. But majority of the dressings, wound dressings, I know that sometimes we don't do sterile dressings in Jamaica, but majority of the dressings over here that I have seen so far, it's non-sterile dressings. So not to say to put your sterile dressing on the shelf, but you're gonna see less of that here. Another thing is dress code. So we don't wear white over here. You don't have to worry about washing your white uniform and if it's gonna turn brown or black or other than white. You wear a scrub, pants bottom, pants top, and if you don't wear pants, you can wear a skirt. So every hospital, each hospital has their different color scrubs that you're gonna wear. Some just say wear scrubs. It doesn't matter the color, but the fact still remains, this is not white, you are wearing scrubs, right? For the shoes, normally you have to wear white nursing shoes or brown, I think. Over here, any color. When I first came, I was freaked because when I came, I bought a black sneakers, and when I went to the hospital, I saw pink, I saw purple, I saw blue, I saw multicolor sneakers. I'm like, what is this? So I'm like, okay. So the next time I bought my sneakers, I bought a pink. No, it's a burgundy. I have a burgundy sneakers to wear to work. It's not black anymore, or it's not white. Hello, we're moving out of that. When you come over here, you wear any color sneakers you want to wear. As long as it's closed-footed and it's appropriate for work, you wear it. Another thing is your hairstyle. You know, when we're in Jamaica, you hear pull your hair up. Make sure it's off your shoulders. Yeah, I'll mash up my hairstyle. Make sure it's off your shoulders. Make sure it's up. Make sure it's your natural complexion. And even if you change the color of your hair, it can't be too bright. Hello. When I came over here, I saw people in pink hair, orange hair, red hair, any color hair. I was like, what is going on? And nobody was saying anything to them. So over here, you can wear any, it's like an express, you can express yourself in any form, shoes, clothes. Just make sure that you are fully attired and you're well dressed. But the hair and everything, yeah, any color will do, any style will do. That's not what we learn in Jamaica. So it was a bit shocking, very shocking to me. For Foley, inserting a Foley or a catheter, we know that in Jamaica we can only insert it in females. So when I came over here, I was told, I got a patient and I was told, you're gonna have to put the Foley in, and it was a male. But the thing is, when I came over here, my recruiters and my company, they gave us orientation, so we got orientation on it, so it wasn't that bad, but it was still a bit weird to me that I have to put a Foley in a male. Normally I would watch the doctors on the ward. Dr. Roselle, big up yourself. I have to watch the doctors on the unit to put it in. So I remember watching that. Or unless you work at a Euro clinic, you would put it in. But for me, we, on the normal population, we don't put in Foley for males. So when you get over here, you're gonna have to put in male Foleys. So just prepare your mind for that. Sick days. If you call out sick, you don't get any pay, or you have to use your PTO, meaning I think it's paid time that you have. So it's like a number of hours that you generate while you're working and you have not called out, you generate some hours, and that certain amount of hours are the only hours that you can use when you call off. And now if you don't have any of those hours, you won't get any pay. With my agency and others, you don't get any pay. If you don't have any PTO, you just call that day quits, because you're not gonna get any money for it. As I said, back to the hotel business, I remember my friend used to tell me, if you call off, you will not get any pay. It's the hotel business over here. You're not gonna get any pay. So Make sure rain, snow, I know sometimes when rain fall heavy and it wash out your town, you can call and say you can't come to work, I cannot go. Remember, snow or sleet, even if you reach late, you're going to work unless it is a major emergency that you definitely cannot cross it. You have to go to work. Okay, so sick days, call offs, you try to do that as minimal as possible, because it's either you're gonna have to work it back to get back that money, or you're gonna have to use your PTO, which is the hours that you generate based on you not calling off, or you don't get paid. Okay. Another thing, drawing labs. You know that you have your lab people come around and draw labs in Jamaica. Well, for your information, when you come over here, you're gonna have to draw your own labs. So your own CBC, your own BMP, your own everything. You're gonna have to draw the labs. Some hospitals have lab personnel that will go around and draw the labs for you, but some don't. So if you end up at a hospital that you have to, can't say I didn't tell you on JamRock Islanders channel, you're gonna have to draw your labs. Another thing is putting in IV accesses. When we're in Jamaica, we're told we're forbidden to put in IV accesses unless you work in the ER, in the emergency room or emergency department. You're not allowed to do it. When you come, whether you work in the ER or you work in OR or any R, any specialty ICU, you have to put your IV accesses in. And again, some hospitals have IV teams that they deal with the IV lines, they deal with the PIC lines, but some hospitals you definitely have to put your IV accesses in. You definitely have to do your PIC line, dressing changes, you have to put your accesses in, everything. But don't be scared. Don't get scared. Am I saying it right? Don't get scared. Once you start doing it, you will get into the habit of doing it, and so you won't have any problems, and you will have co-workers who are better than you in it, and you can ask them. The ones that you can approach and the ones that you can ask, they're very nice. They will help you along the way, so don't worry, you will get the hang of it. I'm just letting you know all the things that you need to know. Okay. Let's see. So there are no porters. I remember working in my hospital that we call porters for everything, and I know if a certain porter is watching this, he is going to be laughing after us, because majority of us used to call porters for everything. You need to go to x-ray, porter this. You need to do this, porter this. Mental patient is doing that, porter this. Especially on night shifts, I work night shifts. You better know the hospital that you're working, because you are the ones who are gonna have to transport the patient from the room to x-ray, from the room to MRI, from the room to CT. You get the gist. You're gonna have to transport. On day shifts, you will have transport people, but on night shifts, up to a certain point in most hospitals, you are going to have to take the patient yourself. There are no porters to call, because porters are gone home. Majority of the hospitals. Well, the hospitals that I've worked in so far and other nurses that I've talked with and seen, it's the same thing for them. So just be mindful that you won't get all the help. If you work night shifts like me, you won't get all the help to bring to the patient, and sometimes your colleagues will show you where to go. They won't leave you hanging. They will show you where to go, and they will show you the ropes, and then after a while you'll get used to it. You will know what to do, so don't worry yourself about it. Okay, you'll do great. Let's see if I have missed anything. Okay, so I know in Jamaica we have a key, pethidine key, or a narcotics key that we normally latch on our dress with the pin. There are no narcotics keys over here. There are no keys whatsoever. There is an Omnicell, there is a Pyxis, there is something that you get medication from, and it is flowing freely. All you need to do is check it off in the system, and you probably need a witness if you're gonna have to split the dose, or if you're gonna put back the drug, or if you're wasting it. Just be careful, people, when you're dealing with narcotics over here. You can get into a lot of trouble. You probably have to do some testing with your urine, so just make sure that you know what you're doing. Okay, grab somebody as a witness. If you need a witness, grab somebody right away and make sure that you witness. So there is nobody regulating who gets the key, who has a petidine book, no key. It's in the Omnicell or the Pyxis. You're on your own. Your patient want morphine, and there's no petidine over here. There's morphine, there is oxycodone, there is fentanyl. There is so many other narcotic drugs that you're going to experience over here, and it was a shocker for me. I knew that they existed, but I didn't know that I was going to handle them. So yeah, there are going to be other drugs over here that you are going to have to give account for yourself. And if it is wrong, your supervisor is going to call you, or the pharmacy is going to call you, and you're going to have to clarify everything. So just be careful when you're handling it over here. Just remember, there's nobody with no key to walk behind you or any book to record anything. And the last thing that I can think of is we throw away medication cups over here. And in Jamaica, well, at my hospital, one patient used the medication cup. We wash it out with bleach and water and soap and all kind of disinfectant that we can find. We wash it out, let it dry, and give it back another day. Well, over here, you throw it all away. You have none to keep, to wash, to give. Everybody get a new cup each day. Every patient get a different cup. Blood pressure cuff, everybody have a different blood pressure cuff. Nobody use the same blood pressure cuff, which is a good thing. Germs won't pass on. The person contain his own germs to his own self, right? So medication cups are thrown away. Blood pressure cuffs are, everybody have their own blood pressure cuff. The dividing of work, I know that when we're in Jamaica, we divide work. We divide who is gonna do medication, who is gonna do dressing, who is gonna do ward round with doctor, who is gonna do this. And you have your patients. Over here, you're in control of everything for your patients. So if it's 8 patients, you're in control of the patient's ward round, you're in control of the patient's dressing, medication, anything concerning the patient. You are the nurse responsible. Now, you will get used to the system. At first, it will seem very hard because you're not used to it. You're used to split work, teamwork, but you will get used to it as you go along, and it will be as nothing as long as once you get your experience. Okay, so these are the things that I can think about right now that is different from nursing in Jamaica and nursing in US. And if I can do it, I tell anybody, if I come over here and I can do it, trust me, you can, because it's tough. So those are the things, and I hope that your eyes have been opened to certain things, and that you won't worry, you won't fear, you will go strong knowing that you have already known these things, and you can know that, hey, I've got this, because guess what, you've got this. Or 360 buzz this week. So I hope I won't gross anybody out, but this week in my 360 buzz, I'll be telling you of the things one thing in nursing that grosses me out. I'm a nurse and I can take anything, blood, maggot, anything else, but one thing I cannot manage is mucus, spit, anything coming out of the mouth. I cannot deal with it. It crawls my skin, and I know that nurses out there are things that makes your skin crawl, and I would like to know in the comments below what makes your skin crawl as a nurse. What things just that you cannot manage. Mine is mucus or spit or anything, and so when I'm doing trach here, I'm like, Jesus help me. I will do it, and I will do it to the best of my ability, but I am dying inside, but the patient cannot see that on my face, right? So that's my 360 buzz. As I said, I would like to see in the comments below what grosses you out as a nurse, as we share together. Have a wonderful day, people, and remember, you're nurses, you're great, you got this.